The pH scale, or what we measure acids with, we measure acids through the use of the atoms of hydrogen. So we have pH, or the potential of hydrogen. And so what we have is a scale from 0 to 14. 0 to 7 is basically the acid side, where 7 is neutral, and then from 7 on is the base or alkaline side of chemistry. Very simple scale, right? Look at Coca-Cola, Dr. Pepper, Pepsi. They all have a pH of about 2.8, 2.9, 3 pH. So let's call it 3 pH. Pretty hot stuff. Put a Coke in your mouth and burn my mucosa, because acids burn. Ow! Or you can feel the heat from acids, right? Gatorade. Minnesota School of Dentistry found Gatorade to be 2.85. So I heard the National Football League got wind of that. I hope so, because you don't rehydrate in an acid medium. That's what dehydrates you. You rehydrate in a base or alkaline mix. So why would they sell Gatorade to anybody? I don't know. Or any of them. These are acid drinks. We got to get away from acids. Part of the problem, not part of the solution. So you look at hydrochloric acid in the stomach, 1.8 to 2 roughly, 2 pH, 10 times hotter roughly, let's say, than Coke. Pretty hot. Break down proteins, you know, break down your skin, in other words. Put a little hydrochloric acid, uric acid somewhere in that same level. How about battery acid? We know battery acid would never put on the skin. That would burn that skin right off, right? Because that is a pH of 1. So battery acid, pretty friggin' hot, right? 10 times hotter than hydrochloric acid, and 100 times hotter than a Coke. So imagine something 100 times hotter or more acidic than a Coke. Pretty hot stuff. Now, chemotherapy. Chemotherapy has a pH basically 1.5 to 2, maybe 2.2. The earlier chemos were closer to battery acid. The newer ones a little more less acidic, shall we say, but still right there with hydrochloric acid, or a little hotter. I say somewhere between 10 and 50 times hotter than the 3 pH acids that are damaging the cell. So let me see if I've got this right. Your cellular wastes or acids, they're roughly around 3 pH. When these acids can't be eliminated out of the cell anymore because of lymph stagnation, you have intracellular acidosis. These 3 pH acids is what creates an atypical or a cancer cell. We're going to treat that problem with an acid that's 10 to 50 times hotter because well, I can't come up with a reason. Well, let's see. We're certainly going to put it in the blood. Well, wait a minute. The blood can't be acidic because then you have to still calcium. I had a hospital administrator at one of my classes one day, and he said, I know a statistic you don't, I bet. And I said, what's that? And he said, do you know how many people die of aortic aneurysms from the use of chemo being poured through a subclavian port right into the aorta? I said, you know, I never even thought about it. I had a lady come in one day, severe parathyroid weakness, bruising easy all over the place, and varicose veins, and she said they won't give me a chemo. I said that was one of the first smart oncologists I've ever heard of, because giving her chemo would have just caused an aneurysm all over the place, killed her right off. Now, they better wait and kill them within a 5-year period. I mean, I've never heard of anything more insane than using cancer-causing treatments. Radiation and chemo are one of the top cancer-causing treatments. Why would you use a cancer-causing treatment to treat cancer? To treat a damaged cell from acid? Forget the word cancer. That's their crap department they use to get money from you. This is a damaged cell by acids. You're going to take a hotter acid, 10 or 50 times hotter, to kill it? Well, whatever affects one cell affects all cells. Thank you very much for that. So what's going to happen? You damage a lot more cells, and anywhere you have cells already being broken down by acids, that's your next hot spot. It already is a hot spot. That becomes your next cancer. Cancer doesn't get up and move on you. Are they smoking something in the back room? You can't take a cell, pluck it out of the liver, carry it to the brain and make your brain cells cancerous because a liver cell is cancerous, got damaged by an acid. What are these guys are insane. You can't do some of these things. This whole thing, that's just how they control and manipulate you. They control and manipulate you through fear. This huge machine that's killing people, and no judge, nobody's looking or taking or understanding this and putting them to task, charging them with manslaughter. No, it's okay. We can kill people. Is it okay to kill 90% of the people you're using your therapy on? Someday you'll wake up to the real stats of the death rate from the use of chemo and radiation, and your mouth will fall open and you'll break your jaw when it hits your desk. It is unbelievable. And I've said this before on videos. Look at how many movie stars you know of that got cancer, and is 90% of them or more still alive and doing well with no cancer? 99% of them are dead, unless someone started using natural therapies to help them stay alive